Let's define providers into several segments. So on the provider side of the street, we'll have the acute care settings, hospitals, health systems, and then we have the physician practices. So we'll separate those two for the time being. On the hospital side of the street, hospitals are struggling. They're struggling because they typically have been the recipient of patients. Patients came there because they had no other choice. They were sick, they were ill, they presented at the ER. And so the whole nature of them becoming very focused, patient-focused and customer-centric has been a struggle. There are organizations out there like Malcolm Baldrige and the Studer Group and Press Ganey, which is all dealt with patient satisfaction. But at the end of the day, these are individuals, professionals that work in healthcare systems, are in the situation of dealing with what we'll say is critical demand in a very tight time frame, typically in a very austere financial setting. And the whole concept of taking time out to make sure that every patient is being taken care of the way they would like to is not where it needs to be. That being said, most patients are there simply because they're ill. So they're not feeling well, they want more attention, their accommodations are not where they need it to be. So that is different, and we're seeing that at all levels of the operation. The CEOs are struggling with it simply because whereas before their orientation was towards the physicians, somewhat of the community, and the internal operations, they now are dealing with patients that can make a decision whether they should show up there or not. CFOs are probably having even more of a difficulty with it, whereas before they didn't even come in contact with a lot of physicians. Now they're having much more interaction with physicians. Physicians are questioning the bill, and they're trying to understand, why am I coming here? Why is it costing so much? Physicians, as part of their medical training, never got schooled in customer satisfaction. In fact, from a scientific standpoint, it was get in, make the assessment, take care of the treatment plan, move on to the next patient. And in a physician office, they literally now are time sliced to the point where they're trying to have the most benefit in the smallest period of time. That's not because anyone wants it that way, but that's because economics is driving that way in terms of the reimbursement rate. So being now in an environment where customer service and customer satisfaction is tied into quality, and part of your reimbursement model is a very difficult thing for a physician to get their brains around. Not because they're not intelligent enough to do that, quite the contrary, they are. The model that they have set up to be successful in the past is not the same model that can accommodate what is needed for the future. In terms of the transition from what we'll say is the traditional model to the model that we're going with the Affordable Care Act, I think what was driving that, at some point, the gross domestic product, it was representing 17 to 18% was health care. And a number of economists basically projected and predicted that the crush depth for the U.S. economy was if healthcare hit about 20 to 21% of the gross domestic product, the country would fail. And so it gets down to, how do you manage care, especially with the baby boomers. I'm a baby boomer myself, and the highest level of care occurs in the last 5 to 7 years of your life. How do you manage that, and how do you really get it to a point where it makes sense? So I think the whole model of working towards preventative care, keeping us healthy, managing chronic care, how do you manage the acute asthmatic and make sure that they don't have an acute situation that requires them to visit an ER, and managing that whole setting is part and parcel of where the model needed to go. So I think if we had kept on the path that we were going, ultimately we would have collapsed, and that would have had more catastrophic events than taking the measures we're taking now. Now, that being said, there are folks out there that are detractors of what is going on to date, but we needed to do something. I think everyone in healthcare recognized that something needed to happen to prevent what was the escalating cost of care. Right now, the U.S. is almost twice as much in terms of the cost of care than a lot of our European counterparts. and our European counterparts have much higher qualities of care than we do. So that says something about what was wrong with the system and the course corrections that needed to happen. I think one of the great things about healthcare today is literally that we are going through a change that is reminiscent of what happened in the 60s. I mean, if we think about the Affordable Care Act in 2010 and what the ramifications were there, it is very, very much akin to the Civil Rights Act of 1964. The Civil Rights Act didn't indicate what needed, how it needed to be fixed. It just basically said, this is something that's wrong. This is what we need to do in terms of making it right. Now make it happen. And as we all know, it took somewhere between 30 and 50 years to make those changes. I think the Affordable Care Act and what's going on in healthcare today is very, very similar. Healthcare was going in a direction that it was no longer supportable. And we as a country and as a society needed to come up with a solution that made sense. Some of it is going a little bit too fast, some of it may be going a little bit too slow. There were always detractors, there were always supporters. But at some point in time, we needed to make change. And we needed to make change that would last and that would show an improvement. And I think it's very, very important, and I think it's a great time to be in healthcare, to be part of making those changes. And it's what keeps me going every day.